Good boy, aren't you? What is that? My first reaction when I see the python is he's a big boy, but then straight away you're drawn to this lump. It's huge and it's hard. But what the hell is it?
Back at the Bondi Referral Hospital SASH, 5-year-old Max is finding it almost impossible to breathe.
Max, like most pugs, struggles with his breathing. He starts to actually wheeze now, or he gets raspy. I get really upset. I find it quite stressful. I mean, I'm worried he'll have a heart attack. I love him so much. He's just adorable.
Who's this, Max?
That's Max.
Hey, Max. I could hear you a mile away, mate. Hey, Max. How you doing? He's got what we call an elongated soft palate. It's a little dingly-dangly thing up the back of your throat. And it's too long, so every time he breathes in, it gets sucked into his voice box and not enough air gets through, so he makes a sort of sound. If we don't do something now, he will get laryngeal collapse or voice box collapse. And get to that point, there's not much we can do.
An operation is the pug's only chance of leading a happy, normal life.
Worst case scenario, I've seen dogs like this where we've ended up having to put permanent tracheostomies in them. Now, this is very much worst case scenario, and I guess I don't mean to scare you.
The tracheotomy, no, that's no life for a dog. I really hope that we don't have to go down that path. That would be horrible.
I know. It's not quite as nice as home, is it? Hey?
I'm trying to stay positive, but in the back of my mind I'm worried about, I don't know, never seeing him again. That's also a possibility. Yeah. Oh, Max. You'll be a good one.
What is that?
Back up on the New South Wales coast, Chris's relaxing weekend has been put on hold by a python who's eaten something it shouldn't have.
I think it's a marble egg.
A marble egg?
Yeah.
What, they're laying marble eggs in here now?
Yeah, right. Now, we put him in there to encourage the chickens to use particular boxes because they all crowd into one box. So we put in a fake egg, and I think he's eaten it.
You're kidding me? Python was just doing what pythons do. They go looking for meals. So he's come on in here, looked for a few eggs, then found the mother lode. You want this back?
I'd like it back if I could, please.
Michaela's sister gave her the egg as a gift.
It's about the size of a duck egg. I think it's about that big.
I'm trying to think of a name for him, and the one that really makes sense to me, Rocky. It's just because he's obviously got a fight in his hands. That's the only reason. There's a lot of joking around, but medically, this is quite serious. I would have hoped that this python may have even had a chance at regurgitating this egg back up, but now looking at where it's lodged, it's just too far down. Even with all the great forceful digestion these guys have, all the enzymes, you can't break down marble. My feeling is it's going to be really hard to avoid surgery here because that egg can't get out any other way. And if it was to stay there, it's going to block up his digestion, it's going to cause a lot of pain, and it will eventually kill him. Max, you're so good boy.
Max is about to have surgery on his soft palate. Hopefully it will allow the pug to breathe normally once again.
If he doesn't get this surgery, he'll just basically have to sit in an air-conditioned room for a while and get taken out for little walks in the cool of the morning at night time, and then the rest of the time he just leads a sedate life. It's not much of a life for any dog, but pugs are, pretty vivacious.
If the operation fails, the pug will need a permanent tracheostomy, a hole in his throat to stay alive.
So this is his soft palate, here. It just, when he breathes, it just gets sucked down into this airway here. So we're going to do a procedure which we call a snoroplasty, and that'll stop all that vibration when he's trying to breathe and run around.
Andrew Marchevsky is now using electrosurgery to tighten the lining of the soft palate. Often used in human operations, the electric current minimises bleeding.
And it's a crowded little area. He hasn't got a big mouth. No? So that's just the tip of his soft palate.
But Max's surgery is not over yet.
Max is going to get a bit of a nose job. It's not going to make him any prettier, but it's just going to make him a bit more functional. So we're just going to take a little wedge of tissue out of his cartilage in the nose, and having taken that out, then suture it. The surgery side of things is sort of the easiest part. The recovery is when I'm most tense.
Andrew will soon know whether Max needs to have his windpipe cut open and a permanent tube inserted.
You need to open your mouth as well, mate. You can't rely on just your nose.
He's trying.
Finally, the patient takes a much anticipated breath.
There you go, there's a better breath. Max was a little dog that was going to start having a lot of problems doing anything apart from sitting around getting fatter. Whereas now he'll be able to run around, exercise, just do normal things. I think his quality of life will be fantastic after this. Poke your tongue out at me.
Chris is a long way from Bondi Beach. He was meant to be catching up with his parents in Newcastle. Instead, he's now on a mercy dash into Coffs Harbour with a sick snake that's managed to swallow a large marble egg.
Drove gently.
Tom from the rescue
very
group
special cargo,
Wires
obviously.
has arranged
Very.
for Rocky the Python to be
This is a
x-rayed
local
at a
thing we go
local
to.
vet hospital.
He's in
Pretty good condition, isn't he?
isn't he? Yeah.
He's so
healthy.
shiny.
Yeah. Very healthy.
You can actually see the outline of it there.
So you can see the other eggs that it's eaten.
Yeah. Well, there's no doubt what was going on. So, 2 small eggs and 1 large. It's a lot bigger than I actually thought it would be. And it's probably pressing on his skin and the wall of his intestine and stomach probably a bit more than I'd hoped it would have been. So this is now probably a bit bigger deal than we thought.
Rocky needs to go under the knife immediately.
The one main weakness of reptiles is stress. They don't really handle it too well and can mean you can actually lose them under anaesthetic or after the operation.
The problem is getting them asleep. Once they're asleep, hopefully it will all go okay, but then you've got to wake them up at the end as well. The quicker the surgeon is, the safer it is for the animal.
I was surprised when we saw it. It looks like she's sort of seen a ghost or something. It looks really terrible.
2-year-old Ellie has been brought into SASH with a frightening case of bulging eyes.
I don't like the thought of any, problems with blindness. We wanted to get it fixed up straight away.
I must say I've never seen anything quite like this. Wow, that's unbelievable. When did this all come about?
Probably a week ago.
Okay, and what happened?
She just started to get a little bit of white mark in the corner of
Oh,
one
she's
eye.
looking at me so
I know.
startled.
I know, it's a
Pretty
bit of a
bizarre.
shock, isn't it?
I've seen animals that have inflammation in other parts of their muscles, but I've never seen it affecting the muscles around the eyes. I know if it was one eye affected, then I wouldn't be as shocked, but the fact that both eyes are like that, I mean, she looks like a Google-eyed fish.
She does. Yeah, she does.
She doesn't seem to be in any pain. She seems like she can see. I really need to get an ophthalmologist to have a look at this one.
Off you go. You're all right, Elle.
Come on, sweetie. Look, I see another doctor.
Snakes have a habit of twisting under anaesthetic. The way you prevent the twisting is tape them to a board.
At Coffs Harbour, Chris is about to start surgery on Rocky.
The big test will be whether he'll feel the incision.
The python swallowed a marble egg, which, if not removed, will shut down his system and kill him.
The tricky thing is, it's going to be a decent sized incision to remove something that is so huge. Here we go. Just a blood vessel sitting exactly where I don't want it to be, just right where the incision is. So just having to do a little bit of a sidestep around that. Just very conscious of the fact that blood loss is a big issue with snakes and surgeries, and with Rocky already being under stress here, we've got to be especially careful with that. So it's all about keeping bleeding to an absolute minimum.
Look at this dog's eyes.
Oh my God, you poor sweetheart. Hello, darling. Do you know what it is?
No, I'm going to go try find Kelly and see if she can tell me. I've never seen anything quite like it. What do you think of the eyes?
It's a bit scary, actually.
Amazing, it is.
At Sash, Ellie's bulging eyes are the talk of the hospital.
It's fantastic.
This is actually a really interesting medical case. I've never seen anything quite like this.
Miss Ellie, do you think we could take a look at these eyes of yours, huh?
Fortunately for the Labrador, eye specialist Callie Caruso isn't as shocked as the rest of the staff.
She's got a nice response to the light. Well, I think the key with her is her age and her breed. And this is the immune system attacking the muscles that surround the eye, inflaming them and making the eyes bulge forward. An extraocular polymyositis. What these dogs typically present is non-painful, visual. They look really kind of creepy, but we usually can fix them, and we can put her on some oral steroids and a little lubricant in these eyes, and I bet she's a new dog.
These little blue tablets are going to make her look a lot better within about 72 hours, which is a pretty quick turnaround. She says, I will be beautiful in a few days, Mum. I promise I'll have my beauty back.
You're beautiful anyhow, aren't you?
I will never forget that look of surprise on Ellie's face when she walked in the door with her eyes bulging out of her head.
I'm just glad to find that they can treat it. And so that was a good thing. A really big load off our mind. She'll probably get a big cuddle, big hug, maybe a treat.
I can feel it on my scalpel blade. I've hit something that isn't snake, it's stone.
Chris has finally seen the marble egg that's landed Rocky in so much trouble.
As any good chicken knows, it's hard to pass an egg, so this is going to be a little bit tricky to get this out. There we go. One marble egg with African pattern with a beautiful zebra featured on the front of it. The thing that really surprises you is just how heavy it is. It's really solid and really heavy. And potentially for Rocky, this is actually the most dangerous part, because if he was to actually have some sort of leakage from this wound here, then that's going to cause a serious infection, and it'd be enough to kill him for sure. So this is the last stitch here. Thing right now is just the waiting. We've got through the surgery, everything's been done, and now we just want Rocky to spring back to life, and that'll make me feel better, but now it's just nothing going on. Just give me something. You all right?
Chris has removed a large marble egg from Rocky's stomach. It's now 3 hours since the surgery finished, and the python still hasn't woken up.
He's cold, so his whole metabolism slowed right down. If we can speed up his metabolism, he's going to wake up a bit faster.
And then the sign everyone has been hoping for.
There we go. He's just starting to curl up his tail here now, so it's our first signs of real life here.
Look at that. Oh, really?
Hey, buddy. You're waking up. Everyone's happy. Tom.
Hi, Chris.
Mates.
Our patient.
One slightly slimmer snake. Oh, look at this. He's still a little bit groggy. He looks great. And
one slightly used decorative marble egg.
That's remarkable.
Is that something?
The fight's not over for Rocky because he has to get through the anaesthetic, recover from that tonight, and then tomorrow really focus on healing internally.
Thank you very much.
That's all right, mate.
But tonight really decides whether he has a great future or not.
See you tomorrow.
See you tomorrow. No worries.
Okay, cheers.
Come on, Maxie, we'll get you home. All right, I know. It's very exciting. It's very exciting, isn't it?
Max came into SASH gasping for breath. Now, after surgery, Andrew has restored his quality of life.
Can't wait. Yeah, I can't wait to see him.
But it will be several weeks before the swelling in his throat goes down, and Max can once again play with his 2-year-old buddy, Gaia.
Look, is that for Max?
Yeah, that's for Max.
That's for Max. Look at that, Max. You got a friend.
That's your little twin.
She is going to have to keep him quiet, and I think it's going to be a little nerve-wracking for her because she's protecting the surgery now.
Calm down. You're so excited.
He's so excited. Every time he makes a noise, she's going to be, is that right? So I expect she'll be on the phone to me in a little while, and that's fine. Bye.
It's a fantastic result. We're just really happy to have him home, the new and improved Maxie.
Tom?
G'day, Chris. In here. How you going?
Hey, mate, how you going?
Good, how are you? Good to see you.
I'm nervous, mate, okay? That's how I am.
I understand.
It's been less than 24 hours since Chris removed this marble egg from Rocky. Without emergency surgery, the python would have died.
Look, mate, I'm really happy with how that looks.
It's nice and clean. He's been fantastic. He's had more sleep than I've had, and I'm tired now.
Oh, he's going back to the favourite position, the blue hand position, he calls it. Just trying to finish me off once and for all.
Chris's rescue mission in Coffs Harbour is almost complete. There's just one last matter to attend to.
Oh my God.
That's it, right?
Yeah.
It looks a bit different.
What did it look like before?
I think it was orange.
It was orange before.
It's now pink.
Jeez.
It is quite different.
Is that a
actually.
stomach acid?
Yeah, that's amazing. I was really happy to have this back, but more importantly, I'm happy that Rocky's actually survived this.
As much as it pains me to say it, Dad was right. I don't think I'll ever see a snake with that sort of problem ever again. But I don't think I'll see this weekend again either. It's gone. So